Primarily, we're a physical therapy office that treats musculoskeletal and orthopedic injuries. And what that really means is that anyone who has a sprain or a strain would want to come here to get relief of pain, improve their function, and return back to the activities that they were able to do prior to their injury. As far as orthopedics concern goes, if you have a fracture, broken bone, or anything, a dislocation, we need to stabilize you. And then also, again, the primary things when people first start here is to alleviate their pain, then to increase their motion, increase their strength, and then really return them to their function. We also treat a number of other injuries, such as if you're injured on the job, if you had a workers' comp injury where you slipped and fell, or if you lifted something that was too heavy for you, which may result in a bulging or herniated disc. Again, we educate you on how to deal with your problem, as well as alleviating the pain and symptoms related to your condition. Besides workers' comp injuries, we also deal with many no-fault injuries. People who have been in motor vehicle accidents who experience whiplash or other soft tissue related injuries related to car accidents. Our age range is from infancy to senior citizen ages, such as 90 or 95-year-old patients with arthritis or just other deconditioning symptoms. We treat infants who are 2 and 3 months old with conditions such as torticollis, where the neck is turned to one side due to tightness of muscles. And with those babies, we work not only with the baby, but also with the parents. Part of our focus here is not only treating the injury, but also educating the patient how to stay healthy and what to do in the future to prevent future injuries. If you have an ache or a pain that lasts anywhere from 2 to 3 days and is not improving in any way, so it's not decreasing or getting better, then probably the best thing for you to do would be to seek the advice and also the examination of your primary care physician. Most insurances these days use the primary care physician as your gatekeeper, where you need to go to them first. Once you see your doctor, the doctor would either do a number of things. One is they may refer you to a specialist, like an orthopedist if you have some sort of bone-related injury, or a neurologist if you have some sort of nerve-type injury, a pinched nerve or sciatica, something along those lines. Once you see these professionals, they would then determine if you needed physical therapy. And what they'll do then is give you a prescription, because in New York State you need a prescription from a doctor to see a therapist. Once you get that prescription, what you want to do is call and not wait. Call your physical therapist, and one thing that we do here is after we take your phone call is we try to get you in within 24 hours, because we know you're in pain, and we know that the faster we get you in here and the sooner we start working with you, the better you're going to feel and the sooner you're going to be on the road to recovery. Once you call and make an appointment here for physical therapy, what we'll do is we will verify your insurance. So we've taken your health insurance information. We'll call your company for you to find out what your coverage is. Then from there, we'll call you back, and this way we would explain to you how many visits you're allowed to come for, and or if you had any out-of-pocket expenses. Then when you come in for your therapy appointment, a lot of people frequently ask, what should I do or what should I bring? The main thing is that you have your prescription with you, your insurance card, and if you want, you can bring your own shorts if you had a lower extremity injury, or you can bring a different shirt, a loose-fitting shirt. But you really don't need to do that, because we provide you with shorts. We also have gowns here, so there's really not a need to bring anything clothing-wise. Once you come here on the first day, we'll have you fill out a pain questionnaire so we can get a better idea of what your problems are and where we need to focus. We also do a health questionnaire so we can find out anything that is in your past that may affect your performance or how we can get you back to your optimal function. And we would help you with any of the paperwork, because it's an arduous task. Anywhere you go in the healthcare arena, there's going to be several forms to fill out, but we try to make it as quick and easy for you. Once you go in and see the therapist would then do an evaluation. Following the evaluation, they'll come up with a treatment plan and treatment goals and discuss that with you and get you started.
Vita Physical Therapy line is speaking. May I help you? I just need to get some information from you. Okay, Dr. Riley. And can I get your name first? And your date of birth? And phone number? Okay, and your address? Okay, have you ever been here before?
Hi, I'm Lana. I'm the schedule coordinator. And what I do is take all the phone calls, people calling for their appointments. People get a prescription from their doctor and they call in for physical therapy, and I take all their information down. I make sure they have their prescription. I get all their insurance information. We try to get them in as soon as possible, usually within 24 hours. We start 6:30 in the morning until 8 at night, so we usually are able to accommodate people. Sometimes people are nervous, they have a lot of questions. I try to answer as much of their questions as I can about the physical therapy and what will happen when they come in. Usually they have an evaluation when they come in. And once they're in for their first appointment, then we schedule usually 2 or 3 times a week. Like I said, we have many hours, so we're usually able to accommodate people, whether they need to come in the morning, afternoon, or evening. Usually people just, they basically want to know what's going to happen to them, what kind of treatment we have, massage and electrical stim, what kind of equipment, the gyms, which eventually most people wind up going to the gym, and people just basically have questions if it's going to hurt, which it's not, but generally they just want to know what's going to happen when they get here.
My name is Nancy Velez. I was in a car accident over 20 years ago, and after having treatment in Brooklyn, where I was living at the time, I moved to Staten Island, and I continue with a lot of pain, lower back pain. I came to Davida Becker, and Maureen Becker was my therapist at the time, and with treatment and exercise, pretty much we got to a place where I was a lot more comfortable, and the end result of that particular situation of my lower back resulted in not needing surgery at the time. But unfortunately, due to another accident after so many years, I came back to Davida Becker in 1993. At that time, actually that was my first time with Davida Becker. I was discharged and then I returned again as a patient, and I was being treated for my cervical area. Since then, after treatment, I rehabilitated to the point where I was able to lead pretty much of a normal life, but still with some stiffness and pain and degeneration of my disc, which the end result was having surgery, which I had in January of 2004. I came back and continued with some more treatment with Davida Becker. And currently right now, I am pretty much at a place where I can lead a normal life and do the things that I hadn't done in a very long time.
I recently had surgery in April of 2005, and I've been a patient of Davida and Becker since June of 2005. I come to the facility twice a week for extensive therapy on my hand and elbow. My condition has affected me severely. I'm on total disability as I'm unable to maintain my normal lifestyle. I'm in severe pain 24 hours a day. Physical therapy has helped me to maintain my pain at a moderate level. The things I'm doing at Davida and Becker is that I'm seeing a therapist who massages my hand and does various exercises. They do stretching back, my hand stretches back. I have a grip that I squeeze. I pull with putty. I'm on various machines, bicycles, pulleys, weights, etc.